USMLE, Step 1. Year 2024, Number 0414. Mumps virus accounts for 10 to 15% of all cases of aseptic meningitis in the United States. Which of the following is most true of infection with mumps virus? A. It usually produces severe systemic manifestations. B. It is apt to recur periodically in many affected persons. C. It is maintained in large canine reservoir. D. It will always cause mumps or orchitis in postpubertal males. E. It is preventable by immunization. Types of meningitis. Bacterial meningitis, caused by bacterial infection, have an acute clinical course, except tuberculous meningitis, which has a subacute course. Its symptoms are severe. Death can occur in a few hours. Those who recover can have permanent disabilities, such as brain damage, hearing loss, and learning disabilities. Aseptic meningitis, mainly caused by viruses, viral meningitis, very common, but its symptoms are less severe, very few serious complications, and for most people, it usually takes less than 14 days to recover from the onset of symptoms. Causes of bacterial meningitis. Streptococcus pneumoniae resides asymptomatically in healthy carriers, typically colonizing the respiratory tract, sinuses, and nasal cavity, however, may become pathogenic and spread to other locations to cause disease in susceptible individuals with weaker immune systems, such as the elderly and young children. Spread by coughing or sneezing. Group B. Streptococcus, a common bacterium often carried in the intestines or lower genital tract. Streptococcus agalactiae is a beta hemolytic, catalase negative, and facultative anaerobe, and the most common. Mothers can pass it to their babies during birth. Neisseria meningitidis resides in the nasopharynx of about 10% of adults. Spread by respiratory or throat secretions, i.e. saliva or spit. Haemophilus influenzae grows best at temperatures between 35 to 37 degrees C and lives in the nose and throat. Spread by coughing or sneezing. Listeria monocytogenes, associated with such foods as raw milk, pasteurized fluid milk, cheeses, hard-boiled eggs, ice cream, raw vegetables, raw meats, and raw and smoked fish. They can survive near freezing temperatures. Spread by eating contaminated food. Escherichia coli, a gram-negative, facultative anaerobic bacillus, commonly found in the lower intestine of warm-blooded organisms. Spread by eating contaminated food. Mothers can pass it to their babies during birth. Mycobacterium tuberculosis, an opportunistic infection with a subacute course with symptoms that typically develop over 5 days or longer. Spread by coughing or sneezing. Primarily, infection localizes in the lung with dissemination to the lymph nodes, followed by seeding of the entire body including the meninges. Causes of aseptic meningitis. Most common viruses, mumps, spread through infected droplets of saliva that can be inhaled or picked up from surfaces and transferred into the mouth or nose. Most contagious a few days before the symptoms develop and for a few days afterwards. Chicken pox, measles, HIV, human immunodeficiency virus, West Nile, herpes simplex, rabies. Other rare cases. Syphilis, fungal infections, cryptococcosis, histoplasmosis, blastomycosis, and coccidioidomycosis, opportunistic infections with a subacute course with symptoms that typically develop over 5 days or longer. Found in the droppings of wild birds, e.g. pigeons, or bats, and in soil. Lyme disease, inflammatory diseases, drug allergies. It is very rare for aseptic meningitis to end up causing long-term illness. Otherwise, it is a very manageable condition that requires very minimal or no medical intervention. Though there is no vaccine for aseptic meningitis, it is important to vaccinate against common viruses that might lead to aseptic meningitis, such as chickenpox, measles, and mumps. It is also important to make sure proper hygiene habits to minimize the chances of getting infected by other people. The answer is E. It is preventable by immunization.